Hello, everyone. So I am the Dr. Yilong Wu from China. So today I will introduce the clinical trial, the GEMSTONE-301. This is the randomized double-blind placebo-controlled Phase III clinical trial comparing Sugemalimab in patients with unresectable stage 3 the non-small cell lung cancer with or without the progression of the concurrent of the sequence chemoradiotherapy. So this is the first clinical trial focused on patients after concurrent chemotherapy or the sequence chemoradiotherapy. Why we are doing these clinical trials? Because the concurrent chemoradiotherapy now is the standard of the treatment of the stage 3, the non-small cell lung cancer. But in the real world, on the 30 to 50% the patient could receive the concurrent chemotherapy. That means that almost half the patient did not receive the concurrent chemotherapy. They are only received the sequence chemotherapy. So we have designed this clinical trial, and we are one to extend our target population from the concurrent chemotherapy to the sequence chemoradiotherapy. As you know, the Sugemalimab is the foreign for the human G4, the mono antibody that target the PD-L1. Before we had the clinical trial, the so-called GEMSTONE-302. This is in the advanced disease comparing the chemotherapy. The C-02 now show in the advanced disease, Sugemalimab plus the chemotherapy is the superior to the chemotherapy. So now we move the advanced disease to the local, the advanced disease. So this is the GEMSTONE, the clinical design. We are include unresectable stage 3 non-small cell cancer who have not progressed from the concurrent chemotherapy or the sequence chemoradiotherapy, and patient without any gene mutation. All the patients randomized 2/1 and the stratification by the equal PS and the concurrent chemotherapy, the sequence chemotherapy, and also total radiation dose. The group of patients received the Sugemalimab 1,200 milligram Q3W. Another received the placebo, also Q3W, and both for up to 24 months the drug use. The trial, the primary endpoint, the PFS by the work according to RECIPE 101. The second endpoint, including the PFS by the investigator over survival, response rate, on digital control rate, on the safety, and so on. We are planning the interim and the final overall survival. We are planning when the promised 175 and the 2-sitter OS event occurred. But in this time, we interim analysis by the PFS 194 event.